Contaminated blood, the worst treatment scandal in the history of the NHS. The government orders an inquiry. More than 2,000 people died after being given blood products in the 70s and 80s contaminated with HIV and hepatitis C.
They deserve to be told what went wrong, why it went wrong, and who is responsible for what happened.
Andy Evans was infected when he was 5 and diagnosed with AIDS at 16. He's campaigned for an inquiry for years.
At the very minimum, we were let down. At the worst, I think there are people to blame for a lot of the infections that occurred.
We'll be asking why it's taken so long to bring about this inquiry and what it might achieve. Good evening and welcome to the BBC News at 6. An appalling tragedy that should never have happened. That's what the Prime Minister called the contaminated blood scandal of the 1970s and 80s. The government today announced an inquiry into the worst treatment scandal in the history of the NHS. At least 2,400 people died and 7,500 patients were infected with viruses such as hepatitis C and HIV after being given blood products by the NHS. Our health editor Hugh Pym reports.
It's been called the worst disaster in the history of the NHS. Patients trusted the service to deliver safe treatment, including haemophiliacs needing blood clotting agents, but they were given products tainted with life-threatening viruses.
So these are the medications for HIV. I take one of those in the morning and one of these both morning and night time.
Andy has had a life on medication because he was given contaminated blood. At the age of 5, he was infected with HIV and hepatitis C. At 16, he developed AIDS. Since then, all he's wanted is answers.
I'm very worried that there was deliberate acts behind these infections. As I say, at the very minimum, we were let down. At the worst, I think there are people to blame for a lot of the infections that occurred.
Much of the inquiry's focus will be on Whitehall and what was happening here more than 30 years ago. Victims and their families have long argued that senior government officials were aware of the dangers with contaminated blood products that allowed patients to continue receiving them. And after that, they say, there was a cover-up. A Scottish inquiry by a Judge Lord Penrose was dismissed by victims as a waste of time, and they showed what they thought of it. An earlier inquiry in England was privately funded with no official status. Today, a Labour MP who's campaigned on the issue told the Commons those affected by the scandal were owed a debt of justice.
They deserve to be told what went wrong, why it went wrong, and who is responsible for what happened. The story of the injustice they have suffered also needs to be set out and told to the wider public. Their voices need to be heard.
And a minister citing allegations that medical records were tampered with announced the new public inquiry.
In light of these concerns and of reports of new evidence and allegations of potential criminality, we think it is important to understand the extent of what is claimed and the wider issues that arise.
The former Health Secretary Andy Burnham, who alleged there was a criminal cover-up, says victims were failed by successive governments.
All political parties have let down those who've suffered as a result of contaminated blood, and all parties must now put differences aside, work together and give them truth and justice without any further delay or obstruction.
And for this campaigner who has hepatitis C, there's only one thing which really matters.
Nobody here is going away. We are staying, we're going to fight, and we want to know the truth. We just want the truth. That is all. That is all.
Whether that full truth emerges after this long campaign will depend on what sort of inquiry is convened and its powers.
And Hugh is with me now. This is decades later. Why has this inquiry been announced now and what could it achieve?
Well, Sophie, government sources are making clear that new evidence has emerged just in the last few weeks, including some published in the newspaper, and the material that Andy Burnham was about to publish. That is their stated reason. But there is a political aspect to this. Only on Sunday, the leaders of the main political parties at Westminster, opposition parties, all signed a letter calling for just this sort of inquiry. And today there was a debate scheduled in the House of Commons called by a Labour MP to debate the issue, and there was a possibility that all the opposition parties might have voted on it. And of course we have new parliamentary arithmetic. So just before the debate began, Downing Street sources indicated the government was minded to set up this inquiry. It came as a surprise to the Scottish government. It will be a UK-wide exercise. They said they'd had no warning and they'd need to have a think about it. But whatever the reasons, whatever the timing, victims and their families are saying they're pleased it's happening, but they won't be content unless it really does get to the truth.
Our health editor Hugh Pym, thank you.